Hi, I'm Dr. Bhavna, Smiledental. Today's topic is about gaps between your teeth. If you are suffering from gaps between your teeth, watch the video till the end to learn about various options to treat those gaps. So in today's dentistry, braces or aligners, composite cementations, also called restorations, veneers, crowns are various options that are available to treat the gaps between your teeth. Which one to choose from depends on various factors. For suppose the age of the patient. If the patient is very young, then you can always think about braces or aligners. If the patient is an adult, then you can also choose from cements, crowns or veneers. The second factor is how much of gap is present between your teeth. If the gap is very small, then cements and veneers would be a better option. If there is a larger gap between your teeth, then cements and veneers wouldn't really work for you. You have to think about crowns or braces. The third factor is the urgency to get it treated. If you have an event coming up and if you want to get it treated in minutes, then always cements are a good choice. But if you have weeks of time, then you can always consider crowns or veneers. And if you have an ample amount of time, then you can think about braces or aligners. Fourthly, affordability. Crowns and cements are more affordable than aligners or veneers. So before all these factors, we need to first address the root cause. Why did the gap come at the first place? It can be due to various reasons like the developmental reasons or due to some strong muscle pull, which is also called as higher labial frenal attachment, or can be due to some periodontal disease, which is also called as gum disease. So depending on what is the cause, we can always treat the cause and then choose the option to close the gap. Any more queries, you can always visit Smile Dental.